Hi, my name is Nora Mashtayel, and today I'm going to talk to you about Down syndrome, challenge and hope. Many of you have children already, or you anticipate being parents in the future. With any pregnancy, there is a chance that your baby will not be born perfect, or what we think is normal. I am going to talk to you about one such genetic anomaly named Down syndrome. Down syndrome is most commonly associated with its unmistakable physical features. People also think that only older women have children with Down syndrome. As a parent with a child born with Down syndrome, that is not the case here. I will go into telling you about the history of Down syndrome. The name Down came from Dr. Landon Down. He did breakthrough research on children with Down syndrome. He was born in the early 1800s, and he studied several of the more obvious physical characteristics of what was then labeled Mongol idiocy. So he got the name, his research actually got the name changed to Down syndrome. His scientific descendants, Dr. Down's scientific descendants, discovered the 47th chromosome in 1959, which is now definitive for the diagnosis of Down syndrome today. According to the U.S. National Library of Medicine, about 15% of people diagnosed with Down syndrome have hypothyroidism, which is a hormonal problem associated with the metabolism. People with Down syndrome have always been associated with being overweight, but now, since tries have been made to detect the hypothyroidism early, even newborn babies can be medicated, and the detrimental effects of the metabolic inadequacies can be eliminated. So basically, to give you a definition of what Down syndrome is, for those of you who are not familiar, it is, according to Encyclopedia Britannica, a congenital disorder caused by an extra chromosome on the chromosome 21 pair. And that gives a person a total of 47 chromosomes rather than 46, which is what we normally have. The physical and mental impacts of Down syndrome range from mild to severe. The 47th chromosome actually throws off the balance of formation of nuclear membranes, as well as possibly weakens other vital functions such as the thyroid, like I said before. Some common physical signs of the disorder include a small head, flattened face, short neck, up-slanted eyes, low-set ears, enlarged tongue and lips, and sloping underchin. Other characteristics of the disorder may include poor muscle tone, heart or kidney malformations, or both, and abnormal dermal ridge patterns on the palms of hands and soles of the feet. Intellectual disability occurs in all persons with Down syndrome and usually ranges from mild to moderate. Congenital heart disease is found in about 40% of people with Down syndrome. And I actually have a friend that we've known each other since we were 14. Her daughter was born with Down syndrome, and she only had 2 chambers to her heart. They built 2 chambers for her heart at Eggleston Hospital here in Atlanta, Georgia. And she is now a thriving 5-year-old kindergartner. So I do want to tell you about what strides are being done today to take away from all the challenges that Down syndrome children have faced in the past, and that is early intervention. It has been instrumental in allowing children with Down syndrome to gain cognition at an earlier age, and for them to develop independent thought processes. So children may receive speech therapy, physical therapy, and occupational therapy, usually in the home, provided by the government here in the United States, for the first 3 years of life to assist them in meeting milestones. Research has shown that children that have received early intervention have a much higher chance to excel academically and cognitively than children that have not received early assistance. I will tell you that my own personal experience in being a parent of a child with Down syndrome has been just joyous. My son Anis was diagnosed when he was 2 weeks old. We had an idea about the possible increased risk when I got the heightened risk results from the alpha-fetoprotein test, which is actually a test that they offer. It's optional at 17 weeks of gestation, and the recommendation was to get a high resolution ultrasound, which was inconclusive, showed no signs of Down syndrome. We were very blessed that Anis, we think, has a mild case, and he has gone through his therapies, and he still is currently in them at 16 months. He was born with an intestinal blockage, which is associated with Down syndrome. He had a surgery, and there were actually no complications after that of the blockage. He's a wonderful child. I would not change one hair on his head. But I will tell you, in closing, that because of these misconceptions, people who live with Down syndrome, there are a lot of people who think that they cannot deal with their child having this condition. Thanks to Dr. Down and many others after him, we know now how to deal with almost every facet of what challenges may come with having Down syndrome. Of course, to find a cure to prevent Down syndrome would be wonderful, but right now we can make the best of this world we live in and hope that there is no end to what we can do to embrace every human flaw. Thank you so much.